Hello, my name is Shia Ritchie, and I'm going to be counseling our client Jessica, a 28-year-old G2 P2 client who is coming in for concerns of a lump on her breast. So here we go. And here is my breast model. So the first thing I want to do is talk to Jessica. Hi, Jessica. And I'd like to ask you some questions. When did you first notice the lump? Has it changed in size, shape, or tenderness since you noticed it? Is it painful and tender? Does it feel smooth or irregular, mobile or fixed? Like, is it moving around when you touch it? Is it only in one spot, or are there other areas that you're noticing this lump? Any skin changes around that area, like redness, or like it's getting a little bit bigger? Have you had any recent trauma to the breast, perhaps an infection, a fever, even mastitis? A question I would ask before that is, are you still breastfeeding? Are you weaning? Have you noticed any breast changes related to pregnancies before, or maybe even your menstrual cycle? Are you using any contraception or other hormone uses? And so I'd like to then say I'm really glad you noticed this and came in. Because you are 28 years old, most breast lumps in people your age are benign, especially when they're found during self-touch exams like in the shower. But any new lump deserves to be checked so we can be sure. So what I'd like to do is look at your breast first, to look for something that may seem out of the ordinary to me, like a lesion or cracks or discoloration or a mass. And I'd like to feel around your breast, and I'm feeling for hardness or a lump or movement or anything like that. So what I'd like to do is I'd like to take my 2 fingers and I'd like to bring them around the edge of your breast, and then I'd like to move toward the center area and then just the middle around your areola. And if you could point out the area that you are feeling that lump to me, I will pay more attention to that area here. So I'm going to take my 2 fingers here. Do I have your permission? Great. So I'd be feeling around here, and I'm feeling for other lumps or masses. And then I'm also feeling around the area that you told me you feel in those lumps to kind of get a sense of what I'm feeling. Does it hurt when I push against it? It does, huh? And did you say that you were breastfeeding? You are